Hello friends, today I'll be discussing the angiotensin converting enzyme inhibitors like lisinopril, enalapril. All the angiotensin converting enzyme inhibitors end in pril. I'm also going to talk about the angiotensin II receptor blockers, the ARBs, like losartan, valsartan. The ARBs end in sartan. The renin-angiotensin-aldosterone system, RAS, will be discussed alongside the indications, mechanism of actions, dosages, common side effects, and contraindications for the angiotensin-converting enzyme inhibitors and the angiotensin II receptor blockers, the ARBs. RAS stands for renin-angiotensin-aldosterone system. It is a complex physiological pathway that regulates blood pressure, fluid balance, electrolyte balance. There are certain conditions that trigger RAS in the body. They include low blood volume, low blood pressure, low sodium level, high potassium level in the blood, and also stress. In this video, I'll focus more on the trigger of RAS by low blood pressure. When there is blood pressure drop in the body, the baroreceptors, which are specialized sensors on the walls of the blood vessels, detect these changes and send signals to the brain, which directs the kidney to release the hormone renin. Renin converts the peptide hormone angiotensinogen produced in the liver into angiotensin I. The angiotensin converting enzyme ACE, produced primarily in the lungs, converts angiotensin I to angiotensin II. Angiotensin II is a vasoconstrictor. It constricts blood vessels to increase blood pressure. Angiotensin II also stimulates the production of the antidiuretic hormone, aldosterone, which in turn increases sodium reabsorption in the kidney. The reabsorption of sodium leads to water retention. I do not want you to forget that wherever sodium goes, water goes with it, and this helps to increase the blood pressure. Also, aldosterone increases potassium excretion. Do not forget, potassium is a vasodilator. It helps to reduce blood pressure by dilating the blood vessels. But RAS intends to increase blood pressure, so the excretion of potassium is important. If angiotensin converting enzyme ACE is blocked by angiotensin converting enzyme inhibitors, then the conversion of angiotensin I to angiotensin II cannot take place. Therefore, angiotensin II is not produced. This is a mechanism of action of angiotensin converting enzyme inhibitors. As stated above, angiotensin II is a potent vasoconstrictor. It causes the elimination of potassium, the reabsorption and retention of sodium, which leads to fluid buildup in the body. All these effects, due to angiotensin II, increases the blood pressure. So, the angiotensin converting enzyme inhibitors block the production of angiotensin II, which help in the reduction of blood pressure. The angiotensin II receptor blockers, the ARBs, block angiotensin II from binding to angiotensin I receptors in the kidney. They also help to prevent vasoconstriction and aldosterone release. All these help to reduce the blood pressure. Examples of angiotensin converting enzyme inhibitors include lisinopril, enalapril, ramipril. All the angiotensin converting enzyme inhibitor drugs end in pril. Examples of the angiotensin II receptor blockers are losartan, omelzartan, valsartan. All the angiotensin II receptor blocker drugs end in sartan. The angiotensin converting enzyme inhibitors and the angiotensin II receptor blockers are used in hypertension, heart failures, chronic kidney diseases. It's also used in preventing stroke and managing type 2 diabetes. The side effects due to these drugs include dry cough. This is because the angiotensin converting enzyme inhibitor drugs block the production of the angiotensin converting enzyme, ACE. This enzyme is responsible for the breakdown of the peptide, bradykinin. The buildup of bradykinin is responsible for the dry cough. Another side effect is angioedema, which is a swelling of the lips, face, and tongue. And this can lead to a severe issue when it causes obstruction of the airway. Another side effect is hypotension, which is a very low blood pressure. When angiotensin converting enzyme inhibitors are taken too much, or in people who are very sensitive to angiotensin converting enzyme inhibitors. Others include dizziness, fatigue, renal impairment. The contraindications of the angiotensin converting enzyme inhibitors and the angiotensin II receptor blockers include pregnancy, especially in the second and third trimester of pregnancy. It's not to be used in people with history of angioedema. It's not to be used in people who have hyperkalemia, which is high potassium level. This is because these drugs increase the level of potassium in the body. Thank you for watching.